Hi everyone, today we're talking about periods, specifically heavy periods. Heavy periods, or menorrhagia as we term it medically, is very common. What shocks me is how under-recognised it is, often by the very women who have it. Time and time again I've spoken to women who have objectively very heavy periods, sometimes alarmingly so. But she will have no idea that what she's experiencing is out of the ordinary. Firstly, some definitions. Menstrual bleeding is considered heavy if you lose more than 80 mils per cycle. That's about a third of a cup. Now, short of catching it all in a cup, that's almost impossible to quantify. So practically speaking, how do you know if you have heavy periods? Well, there are a few clues, such as, for example, if you flood through pads or tampons, if you pass large clots, if you have to double up feminine hygiene products, if you have to change them hourly or overnight, or if you bleed for a week or longer. However, the best guide that your period is too heavy is if it interrupts your life and prevents you from being able to fully participate in work or leisure activities. So I hear you ask, why are heavy periods a problem? Well, there are a few reasons. Firstly, losing that much blood regularly is a recipe for iron deficiency, which can cause some really bothersome symptoms such as lethargy, dizziness, brain fog, poor concentration, headaches, restless legs, just to name a few. Secondly, heavy menstrual bleeding can be a sign of an underlying medical disorder, including, but not limited to, conditions such as fibroids or other uterine growths, thyroid conditions, and bleeding disorders. And thirdly, managing these heavy periods consumes large amounts of mental energy and time, which are commodities that we have precious little of to begin with. And after all that, you know what the best bit is? Heavy periods are treatable. That's right, they're fixable. You don't have to put up with them. Like I've said before, having 2 X chromosomes is not a license to suffer, at least not unnecessarily, as in this case. There are many safe and effective treatments for heavy periods, both oral and non-oral, hormonal and non-hormonal options. The specifics of what these treatments are and which one is right for you is a discussion between you and your doctor. But know that these treatments exist and that we use them very effectively all the time. So let me be clear. Heavy periods are abnormal, harmful, and fixable. So if your period represents anything more than just a passing monthly annoyance, talk to your healthcare professional.